My name is Devin Johnson, and I'm a child neurologist. Why did I want to become a doctor? I came at it from a kind of more circuitous route. I was asked to be the caregiver and actually kind of the stenographer for a former president of the seminary who had Parkinson's. His family had asked me to kind of help him sort of write his memoirs, to help him just kind of organize his papers, his affairs, so that he could kind of revisit a lot of the work that he had done and stay connected with his friends and family. His health kind of declined fairly rapidly, so I transitioned from that role of like helping him write his memoirs to being more of a caregiver, helping get into his appointments, stay plugged in with he had a neurologist having had Parkinson's. And that's what really exposed me to kind of the world of healthcare, caregiving, and especially actually neurology. So getting to work with him, seeing how critical the neurologist role was in kind of keeping him to be able to function as much as he could, seeing the role that therapists played in keeping him healthy and strong. That was really the major impetus I had towards being a doctor. The most rewarding part of the job is seeing the good outcomes, seeing people heal, seeing them get better. I think that's what we all like. And then for those that do have conditions that are long term, that pose a very pose a very difficult trajectory for their lives. It's getting to see them succeed in even small ways, and so kind of helping them even kind of be able to communicate what they need and to meet those needs. That's the most rewarding. The overarching goals that I have for my patients is helping them kind of achieve kind of the roles and careers and jobs that they want to. For those patients that have had some sort of brain injury, it's finding ways in which they can sort of adapt and succeed and function well, finding avenues for them to serve roles that they find meaningful, that they find fulfilling, and kind of working with the families, the patients, and the resources we have here in the area to be able to achieve that, and even to be able to fine-tune that and kind of influence what they find fulfilling and to try to get them into that place. My past education and training is actually started with humanities and English, and I think that's helped well in kind of appreciating the ways in which patient stories sort of define how we can navigate their health conditions, navigate their needs for getting better, for improving. I think that's served me quite well. Certainly training here in the area has influenced me in many ways, both in knowing what the resources are available to us and also knowing how people perceive the healthcare in this area. It was good for me to get out of the area for training, and I'm very happy to have trained in Cincinnati and to have gotten that experience there, and also to see too that even when I'm in Cincinnati, I'm actually seeing patients sometimes from this area. So it's good to have maintained that connection and also to kind of bring what I've learned there back to East Tennessee, the area. Well, yeah, what I most appreciate about our area, like Upper East Tennessee, is certainly our culture. I've grown up, playing music, sort of old time bluegrass music. It's wonderful to have ETSU and the musicians that they bring in that are on faculty, yet they're certainly like world-class caliber. I love that, and I do love the nature of the area, from the mountains, the hiking, the caves, the rivers. It's something that I very much missed in my years of training away from here. So yeah, I'm very, very happy to be back here, and the culture and the history of the area that essentially is my home. Hello, I'm Dr. Devin Johnson. Thank you for spending your time with me, and thank you for choosing ETSU Health.